Shared decision-making process in critical care. Setting the stage. Use a reserved consulting room to ensure privacy and focus. Introduce the healthcare team, including the name, title, and role of each member. Identifying the surrogate decision-maker. Confirm the identity of the patient's surrogate decision-maker and their relationship to the patient. Initiating the conversation. Start with open-ended questions to engage the surrogate decision-maker or patient. Avoid medical jargon to ensure clear understanding. Purpose of communication. Clarify that the discussion is focused on life-sustaining treatments such as endotracheal intubation, mechanical ventilation, chest compressions, and electric defibrillation. Disclosing diagnosis and prognosis. Clearly explain the patient's diagnosis, the severity of the disease, and the expected prognosis. Offer a medical recommendation on the goals of care, whether it is curative, symptom-alleviating, or palliative. Discussing treatment options. Provide a detailed explanation of the risks and benefits associated with various life-sustaining treatments. Discuss alternatives and potential costs associated with the treatments. Providing evidence-based information. Share relevant medical data, such as survival rates for in-hospital cardiac arrest or one-year survival rates for patients requiring mechanical ventilation in the ICU. Addressing medical uncertainty. Acknowledge the inherent uncertainties in medical care and explain them to the patient or surrogate. Exploring understanding and expectations. Inquire about the patient's or surrogate's understanding of the illness and their expectations regarding the prognosis. Discuss their goals of care and identify any conflicts within the family. Assessing values and attitudes. Directly or indirectly ask about the patient's values and attitudes toward life-sustaining treatment. Probing for uncertainty and hesitation. Actively explore any uncertainty, hesitation, or difficulties the surrogate or patient may have in making decisions. Providing support and information. Offer knowledge, tools, or additional resources to help in decision-making. If applicable, propose an experimental treatment cycle to allow decisions to be made after a short-term trial of treatment. Summarizing and clarifying. Recap the discussion, including any medical decisions made and any conflicts in decision-making. Ensure that all points are clearly understood and documented. Communicating with the medical team. Provide feedback to the entire medical team about the shared decision-making process, ensuring everyone is informed and on the same page.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.